The osteoarthritis is a leading cause of disability worldwide, and individuals with a history of anterior cruciate ligament injury or reconstruction are at an elevated risk of developing post-traumatic knee osteoarthritis compared to individuals without a history of knee injury. Altered mechanical loading is a well-defined pathway that contributes to the development of post-traumatic knee osteoarthritis in this population, and this can be measured through things such as gait biomechanical loading or habitual loading. Altered gait biomechanical loading is persistent in individuals as early as 6 months after ACL reconstruction and has been associated with different aspects of knee joint health, such as altered articular cartilage composition, joint tissue metabolism, and radiographic PTOA. It's also been found that there's altered habitual loading compared to uninjured controls within 1 to 5 years after ACL reconstruction. And this has been shown through lesser steps per day and time spent in moderate to vigorous physical activity, but it's unclear how these are associated with biomarkers of knee joint health. And therefore, the purpose of this study was to examine the associations between biomechanical gait joint loading and also habitual loading in individuals after ACL reconstruction. This is a longitudinal study design where 19 individuals participated, and we collected 3D gait biomechanics at 4 months during walking, and we also had individuals wear physical activity monitors on their right hip for 7 days in 3 living settings in order to capture the amount of steps that they took per day. At 6 months, we captured the anterior femoral articular cartilage thickness via ultrasound in the lateral intercondylar and medial compartment. Our results suggest that both biomechanical and habitual loading predict articular cartilage thickness, specifically in the medial compartment. It was the gait biomechanical variable lesser knee extension moment and also greater steps per day that explained 39% of the variance of greater medial femoral articular cartilage thickness. And this thickness has been hypothesized to be associated with greater swelling in this population. And therefore, the clinical implications of these findings, we believe, suggest that poor gait biomechanics should be addressed before increasing the amount of activity as measured through things like steps per day in individuals after anterior cruciate ligament reconstruction during their recovery process.